When people describe their hands or feet as feeling like they are on fire, or say it feels as if thousands of tiny needles are constantly pricking their skin, they often assume it must be poor circulation, arthritis, or simply getting older. This assumption is one of the biggest reasons nerve pain goes untreated for years. The truth is that these sensations are very rarely caused by muscles or joints. In most cases, especially in people over the age of 60, they are signs of nerve damage. Nerve pain behaves very differently from ordinary pain. It doesn't always show up on scans. It doesn't respond well to standard painkillers. And most importantly, it can exist even when everything looks completely normal from the outside. That disconnect between how severe the pain feels and how normal the body appears is what makes nerve pain so confusing and so frustrating for people living with it. As the body ages, the nervous system becomes more vulnerable to slow cumulative damage. Nerves are not like bones or muscles that announce an injury clearly. They deteriorate quietly. Years of stress, subtle nutritional deficiencies, reduced blood flow, long-term medication use, poor sleep, and metabolic changes all add up. By the time burning or tingling sensations become constant, the nerves have often been struggling for a long time. This is why so many people say their symptoms came out of nowhere, when in reality the damage had been building silently for years. After 60, the body's ability to repair nerve tissue declines, and what once would have healed quickly may now linger or worsen. One of the clearest signs that pain is nerve-related is its unpredictable nature. Nerve pain can shift from burning to numbness to sharp electric shocks without any obvious trigger. A person may feel fine while walking, yet the moment they sit or lie down, the pain intensifies. This is especially noticeable at night, when the body is still and the mind is no longer distracted. Damaged nerves begin firing erratically. Signals that should be quiet become loud. Sensations that should be neutral are interpreted as pain. This is why so many people with nerve damage dread bedtime. They are exhausted, but the moment their feet touch the mattress, the burning begins, robbing them of rest and recovery. Another reason nerve pain is so common after 60 is reduced nutrient absorption. As people age, stomach acid levels decrease, and the intestines become less efficient at absorbing essential nutrients. Even people who eat well can become functionally deficient in vitamins that nerves depend on. Blood tests may appear normal, yet at the cellular level, nerves may be starving for what they need to function properly. This creates a situation where people are told everything looks fine, while their symptoms continue to worsen. Over time, this leads to frustration, hopelessness, and the belief that pain is simply something they must learn to live with. What makes nerve pain particularly devastating is not just the physical discomfort, but the emotional toll it takes. Constant burning or tingling disrupts sleep, limits mobility, and slowly erodes independence. People stop walking as much. They avoid social situations. They lose confidence in their own bodies. Over time, anxiety and depression can set in, not because of weakness, but because chronic nerve pain is relentless and exhausting. The most important thing to understand is that this pain is not imaginary, and it is not an inevitable part of aging. It is a sign that the nervous system is struggling and needs support, not dismissal. To truly understand why nerve pain feels the way it does, you have to understand the role of myelin. Nerves function much like electrical wires, carrying signals from the brain to the rest of the body and back again. Just as electrical wires are wrapped in insulation to prevent sparks and signal loss, nerves are wrapped in a protective coating called myelin. This coating allows signals to travel quickly, smoothly, and accurately. When myelin is healthy, sensations feel normal and controlled. When myelin is damaged, nerve signals begin to leak, misfire, and amplify in ways they were never meant to. When the myelin sheath starts to thin or break down, the nerve underneath becomes hypersensitive. Signals that should be quiet become loud. Signals that should be precise become chaotic. The brain receives distorted messages and interprets them as pain, even when there is no injury. This is why nerve pain can feel like burning heat when the skin is cool, or sharp stabbing sensations when nothing is touching the body at all. It is not that the body is being harmed in the moment, it is that the nerve's insulation has failed, allowing electrical activity to behave erratically. Myelin damage does not usually happen suddenly. It develops gradually, especially with age. The body is constantly repairing and rebuilding myelin, but this process depends heavily on proper nutrition and efficient metabolic pathways. As people grow older, the systems responsible for maintaining myelin become less efficient. Repair slows down while damage continues, leading to a slow but steady decline in nerve signal quality. This is why symptoms often start mildly, with occasional tingling or numbness, and then progress over time into more intense burning or shooting pain. One of the most misunderstood aspects of nerve pain is why traditional pain medications often fail to provide real relief. These medications may dull the perception of pain, but they do nothing to restore the damaged insulation around nerves. It is similar to turning down the volume on a malfunctioning radio without fixing the broken antenna. The noise may seem quieter for a while, but the distortion remains. True improvement in nerve pain comes not from masking signals, but from supporting the body's ability to repair myelin and restore proper nerve function. When myelin repair begins, nerve signals gradually stabilize, burning sensations lessen, tingling becomes less frequent, numbness may slowly recede. This process takes time, but it is possible because nerves retain the ability to heal when given the right conditions. Understanding that nerve pain is fundamentally a problem of damaged insulation, not just overactive nerves, shifts the focus away from temporary symptom control and toward long-term recovery. It also explains why addressing the underlying support systems of nerve health can lead to meaningful, lasting relief rather than endless dependence on medications. When people hear the word folate, they usually think of pregnancy, anemia, or general nutrition, but very few people realize how deeply folate is involved in nerve health. Folate is not just another vitamin on a long list of supplements. It plays a foundational role in how nerves are built, repaired, and maintained throughout life. Every single nerve in your body depends on folate to function properly, especially when it comes to repairing damage that accumulates with age. Without adequate folate in its usable form, the nervous system slowly loses its ability to protect and restore itself, and this decline often shows up as chronic nerve pain. At a cellular level, folate is required for the production of critical compounds that allow nerves to heal. One of the most important of these is a molecule involved in methylation, a process that affects hundreds of reactions in the body. This process is essential for maintaining the myelin sheath, the protective coating that surrounds nerves. When folate levels are insufficient, methylation slows down. When methylation slows down, myelin repair slows down. And when myelin repair slows down, nerve signals become distorted, painful, and unpredictable. This chain reaction happens quietly and gradually, which is why people often don't connect their symptoms to a vitamin issue until the pain becomes severe. What makes this situation even more complicated is that folate deficiency doesn't always show up in obvious ways. Many people do not have classic signs like anemia, so doctors may never suspect a problem. Meanwhile, the nervous system is suffering silently. Over time, nerves lose their resilience. They become less tolerant to stress, pressure, and normal sensory input. This is when everyday sensations begin to feel unbearable. Shoes feel too tight, bedsheets feel irritating, standing for a few minutes feels exhausting. These are not signs of weakness or imagination. They are signs that the nervous system no longer has the resources it needs to protect itself. Another important aspect of folate is its role in brain health and emotional regulation. Nerve pain rarely exists in isolation. Many people with chronic neuropathy also experience fatigue, low mood, anxiety, and mental fog. This is not a coincidence. Folate is required to produce neurotransmitters like serotonin and dopamine, which regulate mood, motivation, and focus. When folate levels are inadequate, the brain struggles to maintain emotional balance. Pain feels more intense, stress feels overwhelming, sleep becomes shallow and unrefreshing. This creates a vicious cycle where pain worsens mental health, and poor mental health amplifies pain. As people age, the body's demand for folate does not decrease. In many ways, it increases. Repair processes become less efficient, inflammation becomes more common, and the nervous system requires more support to maintain stability. Yet this is often the stage of life when absorption and utilization of nutrients decline. The result is a hidden deficiency that slowly undermines nerve health. Understanding the central role folate plays in nerve repair is a crucial step toward breaking this cycle and addressing the problem at its root, rather than endlessly chasing symptoms. One of the most damaging misunderstandings in modern nutrition is the belief that folic acid and folate are interchangeable. They sound similar, they are often used interchangeably in conversation, and they appear side by side on supplement labels, but inside the body they behave very differently. Folic acid is a synthetic man-made compound that does not exist naturally in food. Folate, on the other hand, is the natural biologically active form that the body actually uses. For folic acid to be helpful, the body must first convert it into active folate through a multi-step process, and this is where the problem begins for millions of people, especially older adults. As people age, the enzymes required to convert folic acid into its active form become less efficient. Genetic variations, age-related metabolic changes, liver function decline, and long-term medication use all reduce the body's ability to perform this conversion. Studies suggest that a large percentage of older adults cannot convert folic acid effectively at all. When this happens, folic acid accumulates in the bloodstream unused, while the nerves remain deprived of the active folate they desperately need. This creates a false sense of security. People believe they are covered because they are taking a supplement, but at a functional level, their nervous system is still deficient. What makes this situation even more frustrating is that many foods are fortified with folic acid. Breads, cereals, pasta, and processed grains often contain significant amounts of synthetic folic acid. For someone who cannot convert it properly, this constant exposure does not help. It may actually interfere with normal folate metabolism. Unconverted folic acid can occupy folate receptors without activating them, effectively blocking active folate from doing its job. This means that even the small amounts of natural folate obtained from whole foods may become less effective over time. For the nervous system, this is particularly damaging. Nerves require a steady supply of active folate to maintain myelin and repair microscopic injuries that occur every day. When that supply is interrupted, repair slows, damage accumulates, and symptoms intensify. This explains why some people experience worsening nerve pain despite taking supplements and following medical advice. It is not that their bodies are failing them, it is that they are being given a form of nutrition their bodies cannot properly use. This confusion between folic acid and active folate is one of the reasons nerve pain often becomes chronic. Instead of correcting the underlying deficiency, people remain stuck in a loop of temporary relief and gradual decline. They try stronger medications, higher doses, and more interventions, yet the root problem remains unaddressed. Once the body is given folate in a form it can actually use, many of these systems begin to stabilize. Nerve repair resumes. Myelin rebuilding becomes possible again. Pain signals gradually calm down, not because they are being suppressed, but because the nervous system is finally receiving what it needs to function properly. Once the difference between folic acid and folate is truly understood, the role of methylfolate becomes very clear. Methylfolate is not a drug, and it is not a shortcut or a stimulant. It is simply folate in its already active, ready-to-use form. This distinction matters more than most people realize, especially when it comes to nerve healing. The body does not have to convert methylfolate into anything else before it can be used. It bypasses the slow, inefficient steps that often fail in older adults. As soon as methylfolate enters the system, it becomes available to cells that depend on it, including the delicate cells responsible for repairing nerve tissue and rebuilding the myelin sheath. This is why some people notice changes relatively quickly after switching to methylfolate. It is not because nerves suddenly heal overnight, but because the bottleneck that was preventing repair is removed. Imagine a construction crew that has been waiting for supplies for months. The workers are there, the damage is visible, but nothing can be fixed because the materials never arrive. The moment the correct supplies show up, work can finally begin. That is what happens when the nervous system finally receives active folate instead of an unusable substitute. The repair process that was stalled for years can finally move forward. At a biochemical level, methylfolate supports the production of compounds that are essential for nerve stability and regeneration. These compounds are involved in methylation, DNA repair, neurotransmitter balance, and myelin synthesis. Without sufficient methylation, nerve cells struggle to regulate electrical signals properly. They become hyperreactive, sending pain signals in response to minimal or non-existent stimuli. By restoring methylation capacity, methylfolate helps calm these signals at their source. Over time, nerves become less irritable, less inflamed, and more resilient. Another important reason methylfolate is so effective for nerve pain is that it works with the body rather than against it. Many medications force the nervous system into a suppressed state, reducing pain by dulling nerve activity. While this can provide temporary relief, it does not support healing and often comes with unwanted side effects. Methylfolate, on the other hand, supports the natural repair mechanisms that already exist within the nervous system. This is why improvements tend to feel more stable and lasting. As nerves regain proper insulation and signaling accuracy, pain naturally diminishes rather than being artificially blocked. It is also important to understand that nerve healing is not just physical, it is functional. As nerves repair themselves, people often notice improvements beyond pain reduction. Balance becomes steadier, sensitivity normalizes, sleep improves, mental clarity increases, mood lifts. These changes are not separate benefits, they are all signs that the nervous system is becoming healthier and more efficient. Methylfolate supports this broader recovery by addressing one of the most common and overlooked barriers to nerve repair in older adults, the inability to access active folate. One of the biggest mistakes people make when trying to address nerve pain is expecting immediate dramatic results. Nerves are slow to heal, and they always have been. Unlike skin or muscle, nerve tissue repairs itself gradually, layer by layer. This is why consistency matters far more than intensity. Taking the right form of folate occasionally or inconsistently will not produce meaningful results. The nervous system needs a steady, reliable supply of active nutrients over time to rebuild damaged structures like the myelin sheath. When methylfolate is taken daily, the body begins to shift from a state of chronic deficiency to one of gradual repair. In the first few days, changes may be subtle, pain may still be present, but it often feels slightly less sharp or less constant. Sleep may improve before pain does, as the nervous system begins to calm down at night. Over the next 1 to 2 weeks, many people notice that burning sensations become less intense or less frequent. Tingling may come and go rather than remaining constant. These are signs that nerve signaling is stabilizing, even if complete relief has not yet arrived. The importance of dose lies in finding an amount that provides enough active folate to support repair without overwhelming the system. For most people, a moderate daily dose is sufficient to restore function gradually. More is not always better, especially at the beginning. The nervous system responds best to steady, consistent support rather than sudden extremes. This is why patience plays such a critical role in recovery. Each day of proper support builds on the last, even when progress feels slow. Another factor that often surprises people is how nerve healing affects the entire body. As nerve function improves, movement becomes more natural, which encourages better circulation. Better circulation delivers more oxygen and nutrients to tissues, further supporting healing. Improved sleep allows the body to repair itself more effectively at night. Reduced pain lowers stress hormones, which otherwise interfere with nerve regeneration. This creates a positive feedback loop where small improvements lead to larger gains over time. Real recovery from nerve pain is not about chasing the absence of pain alone. It is about restoring confidence in the body. It is about being able to walk without fear, sleep without dread, and live without constantly monitoring every sensation. When the nervous system is given what it needs consistently, it begins to re-establish normal communication with the brain. Pain stops being the dominant signal. Normal sensation returns to the foreground. This is how people regain not just comfort, but control over their daily lives. One of the most confusing and emotionally draining parts of nerve pain is being told that nothing is wrong. Many people go from doctor to doctor, get blood tests done, and are repeatedly reassured that their results are within normal range. Yet the pain continues, sometimes getting worse year after year. What most people don't realize is that standard tests are often not designed to detect functional deficiencies, especially when it comes to nutrients that must be active at the cellular level to do their job. Folate is a perfect example of this. You can have folate showing up in your blood while your nerves are still starving for the usable form they need to repair themselves. There are patterns that show up again and again in people whose nerve pain is driven by folate-related issues. One of the strongest signs is pain that intensifies at night. During the day, movement, distraction, and activity help dampen abnormal nerve signals. At night, when the body is still and the nervous system is no longer competing with external stimuli, damaged nerves become louder. Burning, tingling, and electric sensations suddenly take center stage. This is not because the condition is worsening at night, but because the brain is finally able to hear the faulty signals clearly. This pattern is extremely common in folate-related nerve dysfunction. Another important sign is a lack of improvement despite taking supplements or eating fortified foods. Many people have been taking folic acid for years, believing they are supporting their health, yet their symptoms remain unchanged or even worsen. This creates confusion and discouragement. They assume that vitamins simply do not work for them. In reality, the issue is not the idea of supplementation itself, but the form being used. If the body cannot convert folic acid into active folate efficiently, then the nerves remain deprived, no matter how faithfully supplements are taken. Over time, this can lead to a situation where the body appears nutritionally replete on paper, while nerve tissue continues to deteriorate. A third major sign is the presence of symptoms beyond pain alone. Folate deficiency rarely affects just one system. People often notice increasing fatigue, mental fog, difficulty concentrating, low motivation, or subtle mood changes alongside their nerve pain. They may feel less emotionally resilient, more anxious, or more easily overwhelmed than they used to be. This is not a coincidence. The same biochemical pathways that support nerve repair also support brain chemistry. When these pathways are undernourished, both physical and mental symptoms appear together. Recognizing this broader pattern can be the key that finally connects the dots and explains why pain, exhaustion, and emotional changes often show up as a package rather than isolated problems. Understanding these signs is empowering because it shifts the focus from endless testing to meaningful action. It explains why people can suffer for years despite normal results, and it opens the door to targeted support that addresses what is actually happening inside the nervous system. When people finally recognize that their symptoms make sense and have a physiological explanation, hope often returns for the first time in a long while. Pain medications are often the first line of treatment for nerve pain, but they are also one of the biggest sources of long-term frustration. Over-the-counter painkillers may dull discomfort temporarily, but they rarely touch true nerve pain. Prescription medications designed specifically for neuropathy can reduce symptoms, but they do so by suppressing nerve activity rather than repairing the underlying damage. For many people, this leads to a difficult trade-off: less pain but also less clarity, less energy, and less connection to daily life. The reason these medications fall short is simple. They are not designed to rebuild damaged nerve insulation or restore normal signaling. They act like a dimmer switch, turning down the volume on pain without fixing the wiring. While this can be useful in acute situations, it is not a sustainable solution for a chronic condition rooted in nutritional and metabolic dysfunction. Over time, the nervous system remains fragile, and symptoms often return as soon as medication doses are reduced or missed. In contrast, supporting nerve repair works in a fundamentally different way. Instead of forcing the nervous system into silence, it gives nerves the resources they need to stabilize themselves. When repair processes resume, pain signals naturally decrease because there is less dysfunction to signal in the first place. This is why people who address the underlying causes of nerve pain often experience not just symptom relief, but a gradual return of normal sensation and function. Improvements may be slower than those offered by medication, but they tend to be deeper and more lasting. Another important difference is how this approach affects overall health. Many pain medications place additional stress on the liver, kidneys, and digestive system, especially in older adults. Over time, side effects accumulate, and new problems emerge. Nutritional support, when done correctly, works with the body's natural systems rather than burdening them. As nerve health improves, people often find that they rely less on medications, not because they are forcing themselves to endure pain, but because the pain itself is genuinely diminishing. Perhaps the most profound change that comes from supporting nerve repair is psychological. Living with chronic pain creates fear and hyper-awareness of the body. Every sensation is scrutinized. Every movement is cautious. When nerves begin to heal and pain becomes less dominant, confidence slowly returns. People move more freely. They sleep more deeply. They stop planning their day around discomfort. This shift is not just physical. It is a restoration of trust in one's own body. That trust is something no painkiller can provide, but true nerve healing can. When people hear that a simple vitamin can help nerve pain, one of the first reactions is either skepticism or the urge to take as much as possible as quickly as possible. Both reactions are understandable, and both can be counterproductive. Nerve healing is not about flooding the body with high doses in the hope of forcing a result. It is about providing the nervous system with a steady, usable supply of what it needs to repair itself safely and effectively. The right dosage matters because nerves are sensitive tissues, and they respond best to consistency rather than extremes. Methylfolate works because it restores a process the body already knows how to perform. It does not override normal physiology, it supports it. When taken in a moderate, appropriate amount, it integrates smoothly into the body's existing repair mechanisms. This is why many people are advised to start with a dose that supports daily needs, rather than jumping straight to very high levels. The goal is not to stimulate the nervous system aggressively, but to nourish it reliably. Over time, this steady support allows myelin repair and nerve stabilization to occur without overwhelming the system. Safety is another critical aspect, especially for older adults who may already be taking multiple medications. Methylfolate is water-soluble, which means excess amounts are generally excreted rather than stored. This makes it far safer than many fat-soluble vitamins that can accumulate to harmful levels. However, safety does not mean carelessness. The nervous system is interconnected with many other systems, including the brain and immune response. Taking the right amount consistently allows the body to adapt gradually, reducing the risk of unwanted reactions such as overstimulation or discomfort. Another reason dosage matters is because nerve repair happens in phases. Early on, the nervous system may simply calm down. Pain signals become less intense, but sensitivity may still fluctuate. As repair progresses, nerve signaling becomes more stable, and sensations normalize. This process cannot be rushed. Trying to force faster results by increasing doses too quickly does not speed healing. It often creates confusion in the system. Patience combined with steady support is what allows real progress to take hold. People often underestimate how powerful small, consistent changes can be. A nutrient taken daily, at the right level, over weeks and months, can reshape how the nervous system functions. This is not dramatic or flashy, but it is profound. It respects the body's natural rhythm and gives it space to heal. Understanding this shifts expectations away from instant relief and toward meaningful recovery, which is ultimately far more valuable. One of the most encouraging aspects of supporting nerve repair properly is that improvements tend to last. This is very different from symptom-based treatments, where relief often disappears as soon as medication is missed or stopped. When nerve pain decreases because the underlying damage is being repaired, the nervous system does not immediately revert to dysfunction. Instead, it becomes more resilient. Signals stabilize, myelin thickens, communication between nerves and the brain becomes clearer and more reliable. This is why many people report a gradual but steady return to normal life rather than a temporary break from pain. They walk more confidently, they sleep more deeply, they stop constantly monitoring their feet or hands for the next flare-up. Pain no longer dominates their attention. These changes are subtle at first, but over time they compound, creating a noticeable shift in quality of life. the nervous system begins to behave predictably again, and that predictability is deeply reassuring. Addressing the root cause also changes how people relate to their health. Instead of feeling dependent on medications that merely manage symptoms, they feel actively involved in their own recovery. This sense of agency matters. Chronic pain often makes people feel powerless, as though their bodies are no longer under their control. Supporting nerve repair restores a sense of partnership with the body rather than conflict with it. People begin to trust that improvement is possible, not because pain is being suppressed, but because healing is actually happening. Another reason results tend to last is that improved nerve health influences many other systems. Better nerve signaling improves balance and coordination, reducing the risk of falls. Improved sleep supports immune function and tissue repair. Reduced pain lowers chronic stress, which otherwise interferes with healing across the body. These interconnected benefits reinforce each other, creating a stable environment in which nerves can remain healthy rather than constantly slipping back into dysfunction. Ultimately, lasting improvement comes from respecting how the body heals. Nerves do not respond well to force, but they respond remarkably well to the right support given consistently over time. When the nervous system is no longer deprived of what it needs, it stops sending distress signals. Pain fades into the background, not because it is being ignored, but because there is less reason for it to exist. This is the difference between managing a problem and resolving it, and it is why addressing the root cause of nerve pain can be life-changing rather than merely tolerable. One of the most misunderstood aspects of nerve pain is why it becomes so intense at night, and yet this very pattern is also one of the strongest clues that the nerves are not permanently damaged beyond repair. When people lie down to sleep, and the burning, tingling, or electric sensations suddenly flare up, it can feel cruel and hopeless, as if the body is deliberately refusing to rest. But from a neurological perspective, nighttime pain is not a sign of irreversible damage, it is a sign of unstable nerve signaling. During the day, movement, gravity, and constant sensory input help regulate nerve activity. At night, when the body becomes still and external stimulation fades, damaged nerves are left to fire on their own. If the myelin sheath is compromised, those signals become chaotic, louder, and harder for the brain to ignore. This pattern matters because nerves that still fire excessively are nerves that are still alive and active. Completely dead nerves do not send burning or tingling signals, they send nothing at all. The presence of nighttime nerve pain means the nerve is struggling, not gone. It is asking for repair. This distinction is incredibly important because it means there is still an opportunity for recovery. When the nervous system begins to receive the right support, these nighttime flares are often the first thing to improve. People may notice that the pain still exists, but it takes longer to appear after lying down, or it wakes them up less frequently. Sleep improves in small increments before pain fully recedes, and this is often the earliest sign that healing is underway. Nighttime relief also has a powerful ripple effect. Better sleep improves hormone balance, immune function, and tissue repair throughout the body. When sleep becomes deeper and more restorative, nerves receive more of the growth and repair signals they need. Pain sensitivity decreases, emotional resilience increases. What began as a small reduction in nighttime burning gradually becomes a broader improvement in daily comfort and energy. This is why addressing nerve instability rather than merely numbing pain can lead to compounding benefits that extend far beyond symptom control. Chronic nerve pain does not just affect the body, it reshapes a person's entire life. Over time, people begin making unconscious adjustments to avoid discomfort. They walk shorter distances. They avoid standing for too long. They stop traveling, exercising, or socializing the way they once did. These changes happen slowly, often without deliberate choice, until one day life feels much smaller than it used to. This shrinking of life is one of the most damaging consequences of untreated nerve pain, and it is rarely acknowledged or addressed directly. When nerve health begins to improve, the changes go far beyond pain reduction. People start trusting their bodies again. They move without constantly bracing for discomfort. They regain confidence in their balance and coordination. Activities that once felt exhausting or intimidating become manageable again. This return of confidence is not psychological optimism. It is a natural response to a nervous system that is functioning more reliably. When nerves send accurate, stable signals, the brain no longer has to stay on high alert, and movement becomes fluid instead of cautious. This restoration of independence has profound emotional effects. People who had quietly withdrawn from hobbies, family activities, or social events often begin re-engaging with life. Gardening, cooking, walking, playing with grandchildren, or even just standing comfortably during a conversation becomes possible again. These moments may seem small, but they represent something much larger: the return of autonomy. Pain no longer dictates every decision. Life is no longer planned around discomfort. Perhaps the most meaningful change is the shift in mindset. When people realize that their pain was not an unavoidable consequence of aging, but a signal of an unmet biological need, hope replaces resignation. The body is no longer viewed as broken or failing, but as responsive and capable of repair. This change in perspective alone can be transformative. It encourages continued self-care, patience, and respect for the body's healing processes. Over time, this partnership between understanding and action allows improvements to stabilize and endure. Restoring nerve health is not about chasing perfection or eliminating every sensation. It is about reclaiming function, comfort, and confidence. It is about living without constant fear of pain and without the belief that decline is inevitable. When the nervous system is supported properly, it remembers how to do what it was designed to do: communicate clearly, protect the body, and allow a person to move through life with ease rather than resistance.